Ensuring the safety and the protection of the data is fundamental to the Greater Manchester Care Record platform. The sort of data that is collected by GPs or hospitals isn't designed for research, it's designed to look after patients. So there needs to be a sort of a man in the middle to take that data that's been collected for the purposes of keeping people healthy and their continuing care, and we need to convert that into a form that researchers are used to.
So when we use the Greater Manchester Care Record for research, we only have access to de-identified data. What that means is that we have nothing that would identify the people who are described by the data. So we don't have any names, addresses, telephone numbers, NHS numbers, nothing that could potentially, be traced back to the person. So we only know what happened to their health, which treatments they received, but nothing about the person itself. So that's what we mean by de-identified. So there exists a governance process to decide who gets access to the data and to what data specifically. Researchers can also only access the data through a secure platform. So they never really receive the data. They don't get it in their hands, so to say. They have to log into a system that holds the data and never leaves the data.
I lead a team, we call ourselves data engineers. We have access to the whole database, the whole of the care record. And when researchers want to do a project, they come to us and we can work out precisely what it is they need, and we can extract that data and package it up for them so it's in a format so they're ready to go. We don't need the identifying information, what their name is, where they live, their NHS number. So all this information which could be used to identify a patient, we don't need that, and so that is stripped out before we actually get the data.
Only once we're sure of that, the table or figure can be extracted from the system and then used in the publication. We've got two groups that look at proposals put forward by researchers. One group, called the Expert Review Group, they look at the feasibility of answering that specific question, so whether we would have the data and whether it's appropriate to share that data with the researcher in question. We've got another group consisting of academics called the Research Governance Group, and that group would look at whether this is academically speaking, so scientifically speaking, a good question.
And we can extract that data and package it up for them so it's in a format so they're ready to go.
If someone didn't want their information to be shared as part of the GM Care Record, they've got that ability to be able to speak to their clinician. And it's important that that clinician is able to explain to the individual, the security elements of the record, or the fact that somebody has to have a legitimate relationship with that patient in order to see their information. And that might allay those fears, but where it doesn't, they can ask for their information to stop being shared. And they do that by, they can go to their GP practice and they can speak to a health professional, but that can stop the data feeding into the GM Care Record.